Family HealthCare is a private nonprofit with a governing board made up of more than 50% of our patients. So I've been working in community health centers for a long time, and I love community health centers because we provide care for everyone. We care about everyone. The idea that anyone should encounter a barrier to care is something that we are passionately working against.
Integrated care to me means it's like the team approach of medical. In the games, you have to have more than one person to be able to succeed when you're playing a game, especially football, basketball. In a game of life, in a game of health, we need to have more than one player, not just that medical provider, but you also need to have that behavioralist or counselor, somebody there that touches with the parts that are for the mental health. And then also we have somebody that works with the needs of the community that the person has, a care manager. So it's an approach, of a team approach to tackle all these needs from the patient. I think what comes to my mind is that people used to do us at one dimension, medical, just one part of the person, medical. But now we're more than one dimension. We have behavioral issues, we have home issues, community issues that affects the patient. So when we are tackling that, the part that is behavioral, depression, anxiety, when somebody else is tackling the issue of finances, how to pay for this bill, how to help resources in the community, then the patient feels like we are looking at it, the whole person, not just one part of it, but the whole thing. And it feels like we are helping in the needs that the patient has to be able to improve their well-being.
Integrated behavioral health integrates the behavioral aspects of a person's complete health care, including their physical health care as well as their dental and mental health. We believe that the value of an integrated health care is the value of treating the whole body, the mind, as well as the person, all in one single sitting. We believe that a person can heal himself as well or better if they are also healing their mental health alongside their physical health.
Having good dental care is really important in overall health, and I think it's something for a long time that people kind of separated, both the public and also the profession. But as time goes on, we're learning so much more about the connections between dental health and overall health. There's strong correlations to a lot of different diseases or conditions that manifest themselves in the oral cavity. And if a doctor and a dentist are working closely to help a patient, then they can help one another improve outcomes in the treatment and the lives of that patient. More than anything, at Family HealthCare, we try to just be available for our patients. We try to be there, not just in their time of need, but also when they have questions, educating on prevention, all of those things. And as making ourselves available to the patient is one thing we always strive for here at Family HealthCare.
I think the main thing that I noticed about Family HealthCare is the opportunity that they provide everyone. I mean, we're really focusing heavily on addiction medicine. We really are learning our skills and understanding those particular illnesses. And we don't stop. I mean, if there's a need in the community, I feel like we have a CEO and a board that completely directs us in those directions to serve those populations. That is what is attractive to me about this facility.
The family healthcare helped me a lot with my care baby. I feel worried because I have asthma. I have a 9 years with asthma. The doctor take care very well. Everything is fine.
I think that Fabiola was in a very beneficial situation to have the lab, the dental, the expert for the delivery, and excellent prenatal care all under the same hat. I think it made it really efficient for her, and I think she'll agree to that.
My baby is healthy and strong. I don't have a word for expression, but I feel happy happy.
I think the most striking, moment for me was, and actually I spent a little time down in St. George, so I was able to see her once in a while, and I think she made her appointments, on purpose on Tuesdays because she knew I worked down there, so we could at least hug or say, hey, how's it going, And I heard she had delivered this healthy, beautiful baby boy, and it just made me so happy, okay? I mean, tears of joy. But the real moment was when I had pulled in here, and about a month after she had had her baby, I noticed a different car when I had pulled in, and I didn't really think too much about it, but as I was getting in to walk out, Fabiola gets out of the car and says, Betty, come look at my baby. And of course, she and her husband had driven up just on a special drive, no other reason other than just to show me her beautiful baby boy. And that really touched my heart. That touched my heart. So that was amazing.
I grew up in a family where my grandmother died because she couldn't get care because she didn't have enough money to access care. And that to me is unacceptable. And so I've worked my whole career to try and reduce and eliminate that kind of barrier to care. So Family HealthCare has 4 locations. We have 2 in St. George, one local downtown Main Street site, one over with Mill Creek High School, and one in Hurricane at the middle school, and one in Cedar City co-located with Southwest Behavioral Health.